My name is Suzanne Latham, and today I'm going to be doing a presentation on National Patient Safety Goals for Lynn, a nurse that I work with here in the hospital.
Hello.
And Mitch, nurse that I work with in Cath Lab.
Hello.
So the National Patient Safety Goal that I'm going to be discussing today is hand hygiene to prevent hospital-acquired infections. Joint Commission has developed a list of national patient safety goals, and they do this every year. These goals are to make recommendations to facilities to adopt strategies in response to issues that negatively affect patient safety, quality of care, and outcomes. The national patient safety goal that I'm going to be covering is preventing infection with hand hygiene. Joint Commission makes recommendations to facilities to adopt guidelines of hand hygiene compliance and practices in order to educate staff members to perform proper hand hygiene to prevent hospital-associated infections and cross-transmission of infections to patients by the healthcare staff. They suggest using guidelines that have been initiated by the Centers for Disease Control or the World Health Organization. But the main issue that they want facilities to understand is that they need to be providing a plan or protocols to their staff. And these protocols will consist of evidence-based practices that have been proven to decrease infection. With hand hygiene, it would be proper hand hygiene techniques, including the length of time that you should be washing your hands, which they recommend 40 to 60 seconds, no less than 40 seconds would be adequate. Also using alcohol-based sanitizer when you're entering a patient's room and also when you're exiting a patient's room. After this plan is formed in the facility, Joint Commission suggests that it's implemented into the facility, to the staff members, and that a goal is set. For example, if the compliance in hand hygiene here was 53%, by the way, the national average is 50%, and the facility wanted to set a goal to increase that to 80 or 85% within the next 12 months, then Joint Commission says that the plan should be implemented and then a team should be monitoring that plan to make changes as needed if the goal is not being attained. Why is hand hygiene to prevent infection important? One of the main reasons is because hospital-acquired infections cause approximately 1.7 million in the United States each year, which results in an estimated 99,000 deaths each year. Hospital-acquired infections increase occurrence of pain and suffering, morbidity rates, mortality rates, hospital length of stay, which increases healthcare costs. Healthcare costs are also increased because of the amount of manpower, the machines, and the medications that it takes to take care of patients with hospital-acquired infections. These infections be MRSA, Clostridium difficile, catheter-associated urinary tract infections such as that. Hand hygiene is the first defense against hospital-acquired infections and also against cross-transmission of infection among patients by the staff members. Staff compliance of proper hand hygiene prevents infection that promotes better quality of patient care and outcomes. Increasing hand hygiene compliance improves patient outcomes by decreasing occurrence of hospital-acquired infections, cross-transmission of infection among patients by the healthcare staff, patient discomfort, morbidity rates, mortality rates, hospital length of stay, and healthcare costs that are caused from the hospital length of stay being prolonged, and also from, like I said before, the medications, the manpower, and the machines that it takes to take care of patients with these types of infections. I'm going to read a case scenario to you, and I want you to listen to it, and I have a couple of questions at the end that I'm going to have you answer. Nancy Nurse is providing care for a MRSA positive patient and a post-surgical patient in a busy ICU. Upon entering the MRSA patient's room, Nancy tries to utilize the alcohol-based sanitizer, but realizes that the container is empty. Being pressed for time, she quickly washes her hands and puts on the isolation gown and gloves. While assessing her patient, she hears the call light accompanied by cries of, "I'm hurting," from the post-surgical patient she is assigned to next door. Leaving the room, Nancy removes her gown and gloves and discards them in the appropriate bin. She proceeds quickly to the post-surgical patient's room, puts on gloves, and begins assessing the patient to determine treatment. So what's wrong with this scenario?
Well, the alcohol-based sanitizer is empty. Somebody didn't check that.
Right.
And she leaves the room without washing her hands again. She enters the room next to that without washing her hands prior to putting on gloves again.
Well, she quickly washes her hands when she enters the second room.
Oh, she did? Oh,
Yeah, that's okay.
Mm-hmm.
Okay, and so then, the problem with that is that quickly is probably not 40 seconds.
Right.
Because quickly is probably a quick 5-second washing with soap and water, which is not adequate and not guideline based. So she does put her gown and gloves in the appropriate bin, but when she goes to her other room, she's probably so rattled by the fact that her patient's in pain and she needs to treat them that she doesn't wash her hands and puts on the gloves. So yes, correct. Did Nancy Nurse follow proper hand hygiene procedures to prevent infection and cross-transmission of infection to her patients?
No.
No, she didn't, because she didn't follow the protocols that said to use the hand sanitizer when you enter a room and when you exit the room. Also, hand washing with soap and water 40 to 60 seconds of time. And also, when you remove gloves, to be sure and wash your hands after you remove gloves, because people don't realize that when you remove gloves that you can contaminate your hands with the bacteria as you're removing the gloves. Now, I know that you're probably asking, so where do these guidelines and protocols actually come from? Well, guidelines and protocols are born from research that is done with evidence-based practices that will prove that a certain act that we do in the healthcare world will prevent certain issues that can negatively impact patient safety and quality of care and outcomes. So I'm going to go over 3 articles, and I'm going to explain how the research that was done for these articles proves that by increasing hand hygiene compliance and practices among staff members, we can decrease hospital-associated infections and cross-transmission of infections to patients from staff members. So the first article is Hand Hygiene, Back to the Basics of Infection Control. And in this article, it states that proper hand hygiene by healthcare providers prevents cross-transmission of infection among patients, as well as prevents hospital-associated infections such as MRSA and Clostridium difficile. Washing hands with antimicrobial soap and using alcohol-based sanitizers before and after patient contact decreases cross-transmission of infection and decreases hospital-associated infections. Another thing that people may not think about is that wearing rings. It's important to just wear the minimum amount of rings, and if you can, if you're going to wear a wedding band, to wear one that you can actually take off and put down when you wash your hands, because bacteria harbors under that ring. So you want to make sure that you're cleansing your finger well so that your hand is completely clean before you do any kind of procedures or touch a patient. And we don't want to wear artificial nails, because artificial nails also harbor bacteria, and you want to keep your nails an appropriate length, a short length, because the longer your nail, the more bacteria can harbor up under that nail, and it's harder to clean, and that can also cause infections. The availability of alcohol-based sanitizer and antimicrobial soap, hand hygiene, education of the staff, and visual workplace reminders such as, signs by each door saying remember to sanitize before going in and out of the room, or illustrations of proper hand washing techniques are important to have so that staff members can be reminded that it is very important to follow hand hygiene protocols to prevent infection. Administrative support is extremely important with hand hygiene protocols to make sure those protocols are being followed, and increase staff compliance. And as compliance increases, hand hygiene will help prevent cross-contamination of infection and occurrence of hospital-associated infections. Article number 2 is improving hand hygiene through a multimodal approach. In this article, a study was done at a 30-bed unit in Virginia that noted that their staff compliance with hand hygiene was 35%, which, as I said, the national average is 50%. And they noticed that utilizing a protocol that had one intervention to help improve hand hygiene compliance and practices was not really increasing that 35%. So what they did was they adopted a multimodal evidence-based hand hygiene protocol, and they initiated it using hand hygiene education, daily team huddles where they actually made rounds, and they looked at patients that were already positive for MRSA, and they talked about techniques that needed to be done that day with hand hygiene in order to prevent the cross transmission of the MRSA to other patients in the unit. And they also just made sure that they talked to all the nurses in these huddles and reinforced the importance of proper hand hygiene. They had a campaign slogan, which was increased quality care, increased hand hygiene. Posters and visual cues such as, like I said, visual cues that will remind patients to, staff members to do adequate hand hygiene, and a media presentation for the staff explaining the importance of hand hygiene compliance and how they prevent hospital-acquired infections. The protocol was initiated, and about 12 months later, they went back and looked at their numbers, and they actually found that instead of having an increase to 80%, that their increase was actually to 95%. And their hospital-acquired infections decreased 45%, which that's pretty impressive. Article number 3, moment-specific compliance with hand hygiene. Hand hygiene compliance is effective in decreasing cross-transmission of infection and occurrence of hospital-acquired infections in hospital patients. Non-compliance of hand hygiene among healthcare providers includes forgetfulness to perform hand hygiene, lack of availability of antimicrobial soap and alcohol-based sanitizers, and lack of education of hand hygiene techniques and procedures. Also, lack of hand hygiene importance and how it can actually promote patient outcomes by decreasing hospital-associated infections. The World Health Organization suggests that education of hand hygiene include the 5 clinical moments of hand hygiene as a means to increase staff compliance and decrease hospital-associated infections. Educating the medical and nursing staff about these 5 clinical moments of hand hygiene produced an 83% rate of hand hygiene compliance in a facility in Hong Kong, so it showed that it was effective. The 5 clinical moments for hand hygiene are: 1, before touching a patient; 2, before clean and or aseptic procedures, and that would be like changing a dressing, putting in a Foley catheter, or doing urinary catheter care. 3, after contact exposure with body fluids such as blood, sweat, or urine. 4, after touching a patient. That would be touching the patient's gown, their linens, the bed rails, and that also incorporates one number 5, which is after touching a patient's surroundings. That includes the doorknob in the room, the medication pump, Anything that a patient or family members can touch in the room, we need to be aware that we need to be washing our hands when we're coming out of that room because our hands can get contaminated. Now we're going to do a little hand washing exercise, and what I'm going to do is you have the same handout that I have up here on the slide, and this is how to hand wash. This is according to the Centers for Disease Control and the World Health Association, or Organization, I'm sorry. And they suggest that you wash hands when visibly soiled, otherwise use alcohol-based sanitizer. So of course we know that actually washing our hands with soap and water is probably best, but if you can't do that, then of course alcohol-based sanitizer is also acceptable. And that the duration of washing our hands should be 40 to 60 seconds. So the entire procedure should be no less than 40 seconds. Okay, we don't have any soap and water, so we're just going to kind of pretend that we have some water and soap. And so the first thing that we're going to do is we're going to wet our hands with water. Okay, so let's just say we're wetting our hands with water. And then we're going to put enough soap in our hands to cover the surface of our hand. Okay. All right, the first action that we're going to do is rubbing our palms together, palm to palm. Making sure that you cover the entire surface, the inside of your hand. Next, we're going to take our hands over the dorsal part of our hand, and we're going to scrub that with our right hand. And then we're going to do vice versa with the other hand. Of course, you know this is going to be, you're going to take a little bit longer to do this on each step. Now we're going to do palm to palm, where we intertwine our fingers. You're going to be scrubbing your palms. And what you're doing is you're trying to scrub the bottom part of your palm, because that's where a lot of bacteria might be located. And people don't tend to wash their hands well enough. They want to wash their hands from half of the hand up, and they miss that part. And so that is not completely clean, but you need to try to scrub that. All right, next we're going to do the back of our fingers. So we're going to clutch our fingers and then just kind of go back and forth. And that's going to help to clean our fingers. Now this next step is very important because people forget it all the time. But we have to remember that we harbor bacteria and pathogens in our thumb area in these creases. So we're going to cleanse our thumbs, both hands. We're going to go to the other hand. Okay. Now the next step will be to get under our fingernails, which have a lot of bacteria. And so we're going to use our hand kind of like one of those scrub brushes they use in OR. And we'll scrub. Make sure you do your thumbnail. Okay. We're going to do that on the other hand. Now we are going to rinse our hands under the water. And this is the next step that sometimes people forget when they're in a hurry. When you take down a paper towel to dry your hands, don't turn the water off without using the paper towel. Be sure to use the paper towel to turn the water off because you have bacteria on that handle. And now your hands are clean and you're ready to care for patients. The CDC and the World Health Organization suggest singing the Happy Birthday song twice. And this will be approximately 40 to 50 seconds to do that, and that's an adequate amount of time to wash your hands. So this concludes my presentation of hand hygiene to prevent hospital-acquired infections. And thank you for coming and participating and listening.